I'm Dr. Archana Daftardar, consultant nephrologist at Renova Hospital, Kompally. Today I'm going to discuss about CKD, and it is an educational video in 3 parts. What are the symptoms of CKD? Unfortunately, in early stages, the CKD will not have any symptoms or very non-specific symptoms. Hence, in early stages, the CKD is diagnosed only with the help of the investigations. Otherwise, whenever the investigations are done for some other purpose, then incidentally the CKD diagnosis is made. As the disease progresses, as we mentioned before, like the filtration capacity goes down and there is an accumulation of the waste material in the body, and then that gives rise to multiple complications or multiple symptoms to the patient. The symptoms can be in the form of nausea, vomiting, lack of appetite, generalized weakness, easy fatigability, swelling of the legs, breathing difficulty particularly at nights, or even the urinary disturbances, passing blood in the urine, burning sensation in the urine, or having more urine at night. So, inability to control urine. So, these are the various urinary problems which can happen. Patients may have heart disease associated with kidney problem. So, patients may have complaints associated with the heart disease also. Now, how to diagnose CKD? To diagnose CKD, we actually need only 2 simple tests. One is of blood, which tests the creatinine and which helps us in calculating the GFR, that is the filtration capacity of the kidney. And the second test is of the urine examination, where it is looked for the protein or albumin leak in the urine. The other tests, important test, is the imaging test, that is the ultrasound abdomen, which tells what are the size of the kidney, how the kidney looks, whether it looks normal or not. So that also gives us a supportive clue to the diagnosis of CKD. The other tests like kidney biopsy or some special blood tests are individualized as per the patient's presentation. Coming to the complications of CKD, as we have said before, the CKD can have effect because of the accumulation of the waste product and the excessive water in the body. So, as the disease progresses and becomes more advanced, the more complications are seen in the form of vomiting sensation, inability to eat, and weight loss, or even weight gain because of the water accumulation in the body. Then some other complications like low hemoglobin, because kidneys secrete a hormone which helps us to maintain the hemoglobin, which as the kidney function loses, the loss of this hormone, there is no production of this hormone, or there is a deficient production of this hormone, which leads to low hemoglobin or anemia. CKD, as it progresses, will also have an effect bone health, that is the calcium, phosphorus, and overall bone health metabolism. So these are the other complications associated with kidney problem. And other than that, one of the important complications is accumulation of the fluid throughout the body, which can be in the limbs, that is legs, or dependent areas like back or the legs, and even in the lungs. And the patient may complain of breathing difficulty because of the excessive water in the lung, which he is not able to push it out through the kidneys. The other effects or the complications of the accumulated waste product on the brain can happen, where the patient may complain of lack of concentration, irritability, or there is an altered sensorium. So the other complications like the heart problem or heart attacks in particular are very commonly associated in patients with chronic kidney disease. Hence, and rather, heart problem is the major cause of death in chronic kidney disease patients. Hence, it is important to evaluate for the heart issue whenever the patient is diagnosed with chronic kidney disease.